Hi, I'm Chen, Grace Shenhar, a urology resident from Rabin Medical Center in Israel and a visiting scholar in Stanford University. Thank you for the opportunity to present my work on radiation-induced bladder dysfunction in women during the acute and chronic phases following pelvic radiotherapy, a prospective observational cohort. The WISDOM study was funded by the NIH grant and a Stanford WISDOM seed grant. Acute genitourinary radiation toxicity manifests as urinary urgency, frequency, nocturia, dysuria, bladder spasm, urothelial ulceration, and hemorrhage. Its incidence is 20 to 80% dependent on the radiation dose. After an asymptomatic latent period, chronic changes begin to appear in the bladder. Progressive vascular damage, obliterative arthritis, ischemia, and fibrosis all cause bladder epithelial atrophy, reduction in capacity, loss of compliance, and bladder necrosis. There's not a lot of literature on female patients and their LUTs following radiation therapy. Our aims were to prospectively characterize changes in LUTs during the acute phase of radiotherapy in women treated with radiation for gynecological malignancies, and to systematically quantify the burden of storage and voiding dysfunction in women presenting to moderate volume practice specializing in chronic radiation-induced bladder dysfunction. We used the WISDOM study infrastructure to recruit patients for this study. The WISDOM study is a prospective cohort study of patients with lower urinary tract dysfunction, or LUTD. Patients are recruited from a functional urology clinic and a pelvic radiation oncology clinic to enrich studies on radiation-induced LUTD. Patients undergo clinical evaluation, answer systematic validated LUTs questionnaires, and give urine samples. Each urine sample is given a de-identified ID divided into aliquots and frozen. Questionnaires, patient data, and clinically indicated diagnostic test results, like urodynamics, are entered into a secure REDCap database with the respective urine sample IDs to enable tracing. Since May 19, we've recruited 302 patients, 512 unique samples, and over 4,500 aliquots. This study focused on female LUTs related to pelvic radiation. We recruited women before, during, and shortly after radiation treatment for pelvic malignancies from Dr. Kidd's Radiation Oncology Clinic, as well as patients presenting to Dr. Dobberfuhl's Functional Urology Clinic for LUTs with a history of prior pelvic radiation. Patients filled questionnaires on LUTs and quality of life. 20 patients were recruited, participating in 40 encounters and filling 38 complete questionnaire sets. 12 patients were recruited into the short-term follow-up group with median follow-up of 9 days. 8 patients were recruited into the long-term follow-up group, which had a median follow-up of over 6,000 days since radiation. The mean age was 59 years. Results. The AUA symptom score and the ICIQ F-LUTs score captured differently the changes in LUTs, but generally they correlated with each other. And looking into the details, it seemed that ICIQ F-LUTs showed more consistent changes. In women from the short-term follow-up group, which you can see here, storage and incontinence LUTs were prevalent both before and after radiation. Many LUTs domains were mildly, insignificantly worse during radiation and then insignificantly improved afterwards, while the only significant change from baseline was in the AUA symptom score quality of life during radiation. When you look at individual women, there may be even paradoxical changes like improvement in frequency during radiation, but none of these reach statistical significance. In the long-term follow-up group, patients had worse LUTs in all domains, as captured both by the AUA symptom score and by the ICIQ F-LUTs. Storage and incontinence domains reached statistical significance, and quality of life was worth both LUTs-related, as captured by the AUA symptom score, and health-related quality of life, as captured by the SF-12. Discussion. LUTs are prevalent before, during, and after radiation therapy. We recommend recording LUTs and LUTs related to quality of life before treatment, since these may influence decisions. AUA symptom score and ICIQ FLUTs capture different aspects of LUTs. Incontinence related to radiation therapy is an important issue that's only captured by FLUTs. Study limitations are the small patient numbers that, coming from a tertiary referral center serving a large population, reflects the general low number of women in the population that are receiving pelvic radiation. The long-term follow-up group reflects selection bias, since these are patients that are presenting with LUTs to a specialized clinic. Consequently, this group is less representative of symptom prevalence, but represent the extent of symptom severity and burden. As customary in concluding a presentation, I should say that more research is needed, which is true, and that's why we're continuing to recruit patients and to add intermediate-term follow-up data. Thank you, and hope to meet you in person next year.